Linda DeVico's story is quite extraordinary. After suffering from morbid obesity, chronic diabetes, and being confined to a wheelchair, she underwent bariatric surgery. Today, she's living a life she never dreamed possible. Let's hear Linda's story. Hi, Linda.
Hi.
I'm glad to have you here. Welcome.
Thank you.
Good to see you. Now, let me ask you something. You went through something that you share with a lot of other people, especially in the United States. Why don't you tell us what your situation was, what your life was like? You had, obviously, an awful lot more weight on you than you do sitting here right now. Isn't that right?
Yes, I do.
Tell me about that.
Well, when I was younger, about third or fourth grade, I started to gain weight. It was never really morbid obesity, but it was what they call a chunky. And as I got older, I gained more weight. And the more I gained, the more depressed I got because I would try to lose. I went to Weight Watchers. I've been to Tops. I've tried Metafast. Any kind of diet program you can think of, I've been there and done that. And it's hard, but you just have to have the perseverance. I went to Weight Watchers one time for about a year. I lost about 70 pounds. I thought I could maintain it on my own, stopped going to the program, gained every bit back, plus more. And that's what usually happens. You know, you lose a lot, then you just gain more than you lost.
So aside from gaining weight, other things happened. I guess your diabetes happened?
Oh yes, I was on
depression.
insulin twice a day. My blood pressure, I had problems with that. I started having incontinence. I was depressed. I was on Wellbutrin. It was a mess.
Did your knees have the problem as a result of your weight as well?
Yes.
I see.
Because of the weight.
So therefore, how was life? Are there things that you wanted to do that you couldn't do during that time?
Oh, sure. If you go to the grocery store, you had to have somebody help you because I was in a scooter. I couldn't push the cart and walk, and it's hard to try to ride a scooter and pull a cart behind you. So you always had to have someone with you. And it was very frustrating. I felt like I was useless. And I would just get in fits of depression where I would stay in the house 2 or 3 weeks, wouldn't even want to go outside, had no inclination at all. It's like, you know, you can't do nothing. Everybody has to help you. You're a burden on everyone. You know, people get tired of saying, well, will you get me this? Or can you grab this for me? I can't reach the top shelf. And it's very frustrating. So the weight surgery, when I had that was one of the best things that's ever happened to me. Because now I go shopping by myself. I do everything by myself. I even climb on ladders and paint like I used to do when I was in my 20s.
What was it that triggered you to say, maybe I should see a doctor and maybe have something more involved, maybe some surgery involved? What made you feel that that might be the next step?
Well, because of my weight, surgery was the option for me. If I could have had the surgery the day I walked in, I would have done that. But you have to go through the program. And it's an excellent program. You see the psychiatrist, you talk to the heart doctor, you talk to everyone. They explain it to you, tell you what the risks are, that it's not reversible, that you can gain weight if you choose to do so and eat like you should not eat. And Dr. Sebastian sits and takes time with you and explains the surgery. He shows you the pictures, you go through everything.
What actually did they do in the surgery?
They went in and they cut off a small part of your stomach and reattach your intestines where it goes through your digestive system. I had no pain with the surgery. The first day after surgery, it hurt somewhat, but the next day they took the morphine pump away and it was fine. I took a pain pill every now and then. I'm not one to whine and cry, but it was no problem. I did not have pain. It was an easy surgery. As long as you get up and walk and do what they tell you to do, it goes fine. I'm going to be on bariatric vitamins for the rest of my life. That is no problem. I take vitamin D, I take B12 and take B12 shots. I have to eat like 35 grams of protein a day. Before, I could probably, if we went to a buffet, I used to like to go to buffets all the time. Shrimp, crab legs, rice, 2, 3, 4 plates. I mean, it would be nothing. Ice cream, I used to eat 3 and 4 triple dip ice creams at a sitting because I liked ice cream. Now, If I go, I might eat maybe 3 or 4 spoons of rice, maybe a little meat sometimes, and that just about fills me up. Other than that, that's basically it. You have to exercise and eat healthy. You can't be going to McDonald's and Burger King and eating French fries and doing things like that, because you're just defeating the purpose. They teach you how to eat the right way, be healthy, and do the right thing. And it's up to you whether you do that or not.
Now, what I want to know is, now that you've gone through this whole experience, what about people? Have you noticed a difference in your reaction with people and their reaction with you, since, especially ones that knew you? Have you noticed a change?
Oh yeah, there's people that I haven't seen maybe for a year or two that I used to work with, and I'll walk up and say hello to them. They don't have any idea who I am. It's funny. A friend of mine that I worked with for 20 years up north, I sent her a picture of me, and she didn't know who I was. I just sent it in an envelope. And I called and I asked her, did she get a picture? And she said, yeah, I got a picture. I said, do you know who that is? She said, I don't know, some strange woman. I started laughing. I told her, I said, it's me. And it's like, you know, my goodness.
So I guess one of the happiest days in your life was losing the weight and going into your closet and being able to get rid of all those clothes, wasn't it?
I've went through my closet probably 4 times, and every time it's because I'm going to a lower size, not because I'm going up. I'm going down, and that's the good thing.
That's right. What about your self-confidence, your self-esteem? How has that changed?
Well, I think that it's been such a blessing. Before, you didn't like to go places. I wouldn't like to go bowling. I used to like to bowl. There was a lot of things I used to like to do, but I would never do because of being heavy. And now I do things that I did when I was younger. I don't mind going shopping. I don't mind going to a theme park. Now I can walk through SeaWorld. I don't have to ride in a scooter. I don't have to have people look and say, oh, look, poor, pitiful. You know, it's just a totally different thing. I feel more confident. I know I can do for myself now. I don't have to depend on someone to go to the store with me or help me change a light bulb or paint or do anything. I can do this stuff for myself, and that makes all the difference in the world. I have no more depression at all.
What comes to your mind now when you look back at your photo albums and you see these pictures of how you were for so long, and you look at yourself in the mirror now?
Boy, you were fat. I mean, that's the only, and I never want to be that way again. Never.
Well, I definitely appreciate you being here, Linda. That's a wonderful story, and you look great, and you're moving around, and you're active, and you're vibrant and happy, and no one could ask for more than that from anybody. And I know that you've got a great life to look forward to, and I know your family and friends have got to be very proud of you.
Thank you.
Thank you for being here.
All right.